Hills and Valleys is a podcast that uncovers stories from leaders in healthcare, tech, and everything in between. Straight from the heart of Silicon Valley, we give you a look at the good, the bad, and the future, one episode at a time. Brought to you by Potrero Medical. Hi everyone, Omar Khatib here with Potrero Medical, and I'm joined with Dr. Nathaniel Reisinger here at Kidney Week 2018. Dr. Nathaniel Reisinger, thank you for joining us. Appreciate it. So before we jump in and talk about the future of nephrologists, why don't you tell me a little bit about yourself, your background, what got you into nephrology?
Sure, yeah. My name is Nathaniel Reisinger. I'm a nephrologist at Cooper University in Camden, New Jersey. I just graduated a fellowship not too long ago, about 3 months now in practice. I trained at Penn for my nephrology fellowship, and then I did a one-year ultrasound fellowship after that. I'd really have to say that what got me first into nephrology was just a love of the kidney, of the basic physiology that underlies electrolyte homeostasis. And I had wonderful mentors in my med school who really guided me every step of the way. And it was that mentoring relationship and that love of physiology that first drew me to kidney diseases.
It's fantastic. And, that's one thing that we hear that quite often when you go into residency, you end up picking things that you are most influenced by your mentors. And so can you name some of the mentors that you had the most influence on you in your career?
Sure. I have to say number one would be Biff Palmer. He's a genius of electrolyte and acid base. Learned everything I know about potassium handling from him. He's really an inspiration to his field, both in basic science, but also in clinical research. And personally, he summited Everest recently.
That's fantastic. I'm happy that we're not in Everest right now. We're in this beautiful warm weather here in San Diego. That's pretty impressive. Very nice. And what were some key things that you could remember that he essentially taught you, or some wisdom that he imparted on you back then?
I think the biggest thing in nephrology is really being able to bring a very complex and nuanced field down to some basic building blocks to make learning systematic and engaging for the learner. Nephrology is an incredibly complex field, especially electrolyte physiology, and to be able to make something as complex as potassium handling digestible to your average first-year medical student is a Herculean task.
Absolutely. And, here at the conference at Kidney Week, there's a lot of interesting topics that are being discussed, a lot of discussion around biomarkers, for example, definitely your general courses such as around AKI. So what were some topics that you liked a lot?
I was particularly interested in the debate on the use of point-of-care ultrasound in guiding ultrafiltration in critically ill patients. Point-of-care ultrasound is a particular interest of mine, so I was on pins and needles during the debate.
Interesting. So what in particular got you on pins and needles with the debate?
Well, I thought it was particularly telling that ultimately both sides argued in favor of using ultrasound, but really only differed in terms of their semantics surrounding the questions. I think it's coming into ubiquitous use among critical care providers, and I think really the debate's going to come down to the emergence of and the development of a reliable database, a reliable track record of evidence telling us one way or another, and that just doesn't exist yet for point-of-care ultrasound. So it's really an emerging field.
The one double-edged sword of technology is that you kind of have a portal opened up to you, whether you're a physician or even a consumer, a portal of data and new insights. But a lot of times there's a lot of overwhelming data. They've talked about things such as alert fatigue and whatnot. So as the technology gets introduced to nephrology, what are some perhaps maybe concerns that you might have, and maybe some things that you're also excited about?
Sure. I think the biggest concern in adopting point-of-care ultrasound in the nephrology practice is what to do with that data overload. So often you go to scan a patient and it's not what you're looking for that surprises you. Oftentimes you'll incidentally discover something that is totally unrelated to patient care or something altogether unexpected. So that presents a significant challenge in terms of point-of-care ultrasound, but ultimately you always have backup in terms of referral studies. So if you see something, an incidentaloma or something that's potentially a false negative, you can always back up and ask for the radiologist to perform a referral study.
Interesting. As mobile ultrasound evolves over time, what do you think some exciting applications and perhaps things that are going to be implemented in the training side for nephrologists are going to come out?
I think we're moving towards, Omar, a fully integrated point-of-care ultrasound curriculum for nephrology fellows. I think it's not just the bladder and kidneys that's going to be of interest to the average practicing nephrologist, but it's going to be markers of volume status. So things like quantitative lung ultrasound, advanced cardiac techniques like VTI, supplementing traditional markers of fluid overload in point-of-care ultrasound like IVC measurements. Then I think there's a real potential to add value in the outpatient dialysis market by serial examinations of malfunctioning access, which is the lifeline for so many of our dialysis patients.
Interesting. And it seems that at least in our perspective, that over the years, that with these new and emerging technologies, that a lot of the Kidney Week conferences are sort of getting split, not only focusing on dialysis technologies, but all these other interesting technologies that are kind of opening up a new frontier for nephrologists. And you mentioned earlier that it's going to be more than just a focus on the bladder and kidneys. What other organs, and of course with the body doesn't really think of specialties, right?
Sure.
But what other organs or areas do you think the nephrologists are going to start getting more versed in and being forced to essentially understand a little bit better and maybe go back to the old books and training in third year and fourth year?
Without a doubt, I'd have to say heart and lungs. Just look at your basic epidemiology. Patients with chronic kidney disease are really much more likely to die of cardiovascular events, of heart disease, even more likely than they are to end up on dialysis. And the number one killer of dialysis patients, again, is cardiovascular disease. So I think partnering with cardiologists in epidemiological studies and clinical trials is really going to be the next frontier.
Mm-hmm. Are you excited about spending more time with the cardiologists? Are you guys going to be able to get along in the same room?
I think we can. I think we can build a shared vocabulary together. I think we speak the same language when it comes to fluid balance. But I think it'll take a while for them to fully appreciate what we do in the dialysis unit.
Absolutely. Well, one thing for sure, they have a lot of heart, right? That was good, right?
You got me. It takes two kidneys to make one heart. That was. I have not heard that. That was pretty good. So, one thing we did notice here at ASN is that nephrologists on Twitter, you guys have such a vibrant and engaging group on there. I mean, I think I've learned more about nephrology in the last few days than any graduate school course that I've taken. How do you feel that Twitter's serving as a tool, not only for nephrologists, but also just to kind of get more engaged with each other and share information? Oh, yeah, absolutely. Without a doubt, that is our number one emerging trend in nephrology education, which is so valuable because of the dearth of internal medicine residents now going into nephrology. So a few key players really on Twitter have created in a very short span of time a vast network that brings in trainees and really makes them feel welcome, makes them feel like they have a home, and gives them the resources that they need to succeed not only on the wards but in their career going forward. So there's actually something called the Nephrology Social Media Collective, NSMC. It's run by three nephrology Twitter celebrities, Joel Topf, Matt Sparks, and Swapnil Hiremath, Kidney Boy Joel Hilltop is the leader. You may have heard of him.
Oh, most definitely. He's been trending. His Twitter handle, I think it was about, urine is not the byproduct of the kidney, but it is the product of it, or not the byproduct. See, I messed up that joke. But I think he said, saying that the urine is byproduct of the kidney is like saying that pollution is a byproduct of the factory. Urine is really the byproduct, and homeostasis is the actual product.
Homeostasis is the product of the kidney, and urine is really the byproduct. Exactly.
I'm still a novice, so I'm getting up to speed, but definitely
I think you're doing a great job.
Oh, I appreciate that. I appreciate that. And the nice thing is that it seems that this is a good resource also for medical students to kind of get engaged with nephrologists and see is this an actual specialty I would like, and of course probably help them with their step 1s and 2s.
Absolutely. I think nephrology can be extremely intimidating for trainees, and it's a high barrier for entry. But by bringing the foremost leaders in nephrology education onto social media, you've really made it accessible. And I think what we're going to see in the coming years is a sort of rebound as more people become engaged in nephrology as a result of this. Free open access medical education, FOMED, is really a trend that transcends disciplines. You can go on Twitter now and learn everything. You can learn radiology, you can learn pathology, you name it.
Very nice. And, on the topic of these sort of emerging technologies that are really changing the culture of nephrology, one thing that's been sort of trending up in a variety of different platforms in terms of being discussed in medicine is the use of artificial intelligence, predictive health technologies. How do you see that sort of shaping the landscape in nephrology, say 5-10 years from now?
Absolutely. I think machine learning is going to add another dimension to our already very versatile toolbox in terms of clinical epidemiology. And I think what we're going to discover is that the machines aren't going to replace us, but rather supplement our own analyses. Mm-hmm. In my own field, in point-of-care ultrasound, machine learning has already been harnessed to start to interpret images generated by trainees. Certain ultrasound providers have used this actually to enhance image quality, image generation at the point of care. You can see these ultrasounds now. It'll actually tell you how to rotate your probe, how to improve your image quality, and that's key if you're going to be introducing point of care ultrasound to a lot of inexperienced nephrology trainees. You need someone there guiding them, and if that's a computer, all the better.
Very nice. The other thing that we've noticed a lot of discussion around is these biomarkers, and it seems that nephrologists get quite excited with the idea of having a sensor technology in the urine, in the bladder that can give you a portal into a new world and get streaming data from. But there's so many different biomarkers. Are there any in particular that you feel that are going to become more and more important as research starts rolling out for nephrologists?
Omar, what I think is most important in the biomarker world is really understanding on a molecular level what each of those markers represents. I think we should take a step back and think about our original biomarker, creatinine. Creatinine is a byproduct of metabolism, and it's not always the be-all, end-all of kidney function. So I think understanding that and ultimately translating these new biomarkers to clinical outcomes is going to be of critical importance. Right now we have kind of a weak surrogate marker, creatinine, that we're using to generate our outcomes. Compare that to cardiology, where they're looking at hard clinical outcomes. I think a rising creatinine really can't serve as any longer as our outcome of interest.
And of all the different technologies, so it sounds like, aside from mobile ultrasound for nephrologists, anything else that's come out that you feel that nephrologists maybe should get access to that you see in other specialties?
I would say that there's a lot of technologies out there, and the best approach to adopting new technology is to look for things look for something that already stimulates your own knowledge of basic physiology. Go with something. Go with the new technologies that have a rationale in already established evidence. So when you're talking about these Foley devices with a sensor, certainly measurements of urine output are extremely important, and so that may be more important than just. Your kind of average run-of-the-mill nurse checking off the urine output.
Sure. And, it seems that, especially in the last few years, that patients, aside from really taking not only control, but taking a very active part in their healthcare, now they have these wearable devices that are providing a variety of different biometric feedback and data, and I'm sure that at some point they might be able to get more. Has that in any way influenced the practice of nephrology, or at least with physicians? Is it a good thing or a bad thing that patients have all this data now?
Absolutely. I think one of the bigger technologies that have come out of the past few years is these cardiac monitoring devices. As I said, cardiovascular events are paramount for our vulnerable kidney population. So now they have devices for remote monitoring of telemetry, and we're finding that atrial fibrillation and other arrhythmias are extremely prevalent. More prevalent than we ever thought. And this may actually be related to potassium fluxes on dialysis. There's technology that's coming out now to actually tell in real time, without a blood measurement, what the serum potassium is for a dialysis patient, just based on their EKG tracing.
Interesting. And, you mentioned earlier that some of these different technologies, you're spending some time to create courses and trainings for medical students at this point, correct?
That's absolutely right. I think whenever you're starting to use a new technology, you need a firm grounding in your trainees, so that you're establishing a reliable biomarker of disease. If you're using point-of-care ultrasound without really assessing the quality of your trainees' technique, then you could really be doing serious harm.
Well, Doctor, we really appreciate you spending some time with us and chatting. But before we let you go, I have one last question. A lot of young nephrologists, fledgling nephrologists, will be listening to this podcast, and probably look to someone like you as a thought leader to give some maybe words of advice. Any advice to them in terms of really nurturing and developing themselves into thought leaders in the nephrology community?
I'd really have to say that the most important thing in my own career was following my interest, and really you need to be doing something that really speaks to you. You can't spend time micropipetting in a lab if really what your heart's desire is clinical epidemiology. That's how it was with me. It was only my second year of fellowship that I discovered my true passion was in point-of-care ultrasound. So it really takes you really need to take some time and use this fellowship as an opportunity to discover what really interests you. And I think that's where social media in nephrology can be so valuable, because you have at your fingertips access to the world's leading experts in a variety of subspecialties of nephrology. And literally you can just tweet at them now and gain access to their vast hordes of knowledge. So I think I'd say engagement, really, coming to Kidney Week, coming to our major meetings, and meeting people is the best thing you can do. Just talk to people and hear what they have to say.
Mm-hmm. And now I got to put you out there. So how can we best find you online?
So the best way to find me online is via Twitter. My screen name is @Nathaniel.
Nathaniel. Can you spell that for that?
Sure. It's at NEPHROTHANIEL.
Very nice. Nephrologists have a really good sense of humor. I got to tell you, so you can just tell that from the Twitter handles. So,
I think you can tell a lot about a nephrologist based on their Twitter handle.
Well, wonderful. Hey, we appreciate you spending the time and looking forward to seeing you next year at Kidney Week.
Wonderful. Thank you so much. Thanks for the opportunity to be interviewed.
Absolutely.